Good afternoon, everyone, and welcome to this special Facebook Live. I'm Dan Bevels, Floyd Public Relations Manager, and we're going to be talking COVID-19 rather, and Floyd's response to it and where we find ourselves today. I want to introduce our panel to you this afternoon. First, we have Kurt Stuenkel, President and CEO at Floyd Medical Center, and to his left is Dr. Ken Jones, who is our Interim Chief Medical Officer, and to his left is Dr. Sheila Bennett, who is Executive Vice President and Chief of Patient Services at Floyd. And first of all, welcome the three of you. So glad that you are taking the time to spend with us this afternoon and to update the public on where we are, what Floyd's response is to COVID-19, and what's happened really over the last month. And Kurt, if it's okay, we'll begin with just that. It's been about a month now since the index patient came in at Floyd. Can you talk about where we are today in terms of the work that's being done and how we're responding to this crisis overall?
Yeah, happy to, Dan. Our index patient, what we've called our index patient, was our first patient, and that was almost a month ago. And you know, everybody in the world had been reading about the coronavirus and COVID-19 and how it had first started in Washington State and wondering how it was going to affect everybody else in the nation. And fortunately for us, our medical staff was reading about it too, and reading about it in their literature. And for our first patient, when this patient presented, at that time, the only screening methodology we had was what was provided to us by the government, which was ask them if they've traveled recently and to which countries. And if it wasn't to any one of those countries that was a hot spot, then they passed. They were okay. You didn't need to worry about it. Well, we did have a patient to present that showed some fever and other signs and symptoms, and she showed up in the emergency room to start with. And then a couple days later, she came back feeling even more ill and was admitted, and some imaging was ordered on her. And our radiologists, upon reading the imaging, and particularly the chest CT scan, saw some things that looked like what they had been reading about in their medical literature. And they said, we think this may be COVID-19. We need to be cautious here. And so we admitted that patient to our infectious disease unit, which was a one-bed unit that we had constructed some time ago, back during the Ebola crisis. And then we found out later, with the assistance of our district public health director, Dr. Gary Vocio, we got one of those very scarce tests available to us, and she was positive. You know, one of the first in Georgia, and in fact one of the first on the East Coast that hadn't been to one of those countries or been directly exposed to someone. So this was a community exposure, and it was right here at Floyd Medical Center. And we knew immediately that we needed to start gearing up, and we did. We had the facilities with our infectious disease unit, but then as things have unfolded, we knew that we were going to have to prepare for more. And we've mobilized our teams, and even to the extent that we were able to use some vacant floors in what is the old Kindred building, and it still says Kindred on the outside of that building as people drive by it on Turner McCall Boulevard here in Rome. But Kindred Hospital is no longer in operation, and we occupied that third floor, and that's where we are trying to locate most all of our patients. We have 27 beds up there, and most of the time they're full now, both with confirmed positive patients and those for whom we are awaiting test results, what we term in the industry PUIs. It stands for Person Under Investigation, PUI. It means we've done a test and we're waiting for the results, but then we treat those as if they have it because they have the signs and symptoms, and we want to be extra careful by having people wear all of the appropriate personal protective equipment, the mask, goggles, you know, the whole get-up that Dr. Bennett and Dr. Jones can talk more about. In fact, that's one of our challenges, is adequate supplies of that. We're doing well, but it's a challenge throughout the nation. So in answer to your question, I mean, we've geared up from the beginning. We're used to responding to natural disasters and health crises. We are a regional coordinating hospital for what's termed Region C, and that's a multi-county region here in Northwest Georgia and West Georgia. We're the responsible hospital to help coordinate drills and plans, and that methodology of constantly being ready and drilling and evaluating our response, I think, has given us the mindset to really think things through and to be as ready as we can. And we continue to do that. In the next couple of weeks, we're going to have a a temporary hospital unit that's going to emerge in our front parking lot, provided by Georgia Emergency Medical Management. It's going to be a 20-bed unit. It's going to look much like a tent or a mobile home, and that's frankly preparing for more patients because we expect more patients to be coming.
Kurt, you talked about our preparedness, and that one thing I think that's exemplified by how quickly we were able to mobilize and convert what was the Kindred space. It's now the northeast wing of the hospital. We moved very quickly to get that converted, but also could you speak to just the fact that we prepare all year long. We begin each day with a safety huddle, and how that process might have helped us in what is an unusual situation, but one we feel we were pretty well prepared for.
Yeah, you're right, Dan. In fact, in this room, as people are watching this Facebook session, this is where we hold our daily patient safety huddles at 8 o'clock every morning, and it's a cross-section of people from throughout the hospital. Although I will quickly add, if viewers are able to see this room, I mean, we don't assemble 60 people in here anymore because of social distancing. So we have a handful, maybe a dozen or so folks now that show up for the daily patient safety huddle, and everybody else is calling in by teleconference. And so we're practicing what we're preaching as well. In our meetings, we're keeping them to the appropriate size, people sitting 6 foot apart, and all of those guidelines. But sort of the tenor and the feel of our organization and the way that we approach how we do things is that daily patient safety huddle, as you referred to, every day we're asking questions. What happened in the last 24 hours? Is there anything we need to be aware of? Is there anything we need to investigate? Is there anything anybody wants to raise their hand about that, hey, I need to report this so that we can be aware of it and address it? And that type of atmosphere that we have really, I think, equips us to be able to respond to whatever might happen. And part of our response to COVID-19 and the coronavirus has been to have regular town hall meetings here at Floyd. We started out almost a month ago in this room with people coming, and then as we realized, oh, hey, we got to do social distancing, now we do that virtually using Microsoft Teams. And the last session, we had close to 1,200 people to call in, and they ask questions online, they type it in. The one immediately prior to that, there were 1,600. We've got another one scheduled for this Thursday, and we want to have that open two-way communications. Ask whatever's on your mind. We want to hear what's on your mind, and we want to address it. We want people to be safe. We want our patients to be safe. We want to identify any kind of issues that are out there and see what we can do to make them better if we need to make them better.
So, Dr. Bennett, let's talk a little bit about that, because Kurt mentioned PPE, for instance, and that's just one of many measures that we take here at Floyd to keep our employees safe and our patients safe. Could you talk about some of those steps we've taken?
Yes, I'm happy to. One of the first things I would say is that we have 81 negative pressure rooms, which allows us to put COVID positive patients and persons under investigation in one of those rooms, which keeps the staff safe by having those patients in the room. We try to limit exposure, the number of people who would go into the room. Our approach to personal protective equipment has evolved over the last month. We today issued guidelines that all of our staff will be wearing some form of personal protective equipment, and the reason for that change as this month has gone forward is that we're seeing more and more patients that have presented to the hospital that may be not presenting in the typical manner. They may be asymptomatic in some ways, so we were just trying to make sure that everyone feels comfortable and they feel like we're prepared for them to be here. We also have a no visitor policy, so we're the visitors who are allowed, because we want patients to have support from their family. So we're really thinking outside the box about that. How can we allow them to have contact with them either through FaceTime, for example, or if they're here for a procedure, have them come in with them and then go out maybe and wait in the car. So we understand that, and there's circumstances where we would allow folks to come in, but for the most part we're sticking to no visitors, and that's to limit the exposures as well. And then we're screening our employees, and we're screening them every morning. Some of our departments had already started screening, but Monday morning we decided to screen everyone who comes into our facility to make sure they don't have a fever. So those are some of the things that we're doing to keep the staff safe and protect the public as well.
There's a lot of conversation around the country, and around the world, not just here, about shortages of PPE, but I think our team, and maybe you can talk a little bit about this, but our team has done a fantastic job of, one, we were prepared, as we talked about earlier, coming into this situation, but even beyond that, working with local vendors, working with other suppliers, working with manufacturers to try to stay ahead of that curve.
That's very true. Being a regional coordinating hospital, we had access to storage for things for such as this pandemic that goes back to 2010 when we saw the Ebola crisis. So we had some supplies that we've been able to draw on. Our materials management team has done a wonderful job of keeping things in stock. They're always looking for ways we can purchase more. And then we're also conserving it, and we're adopting practices that allow us to conserve the supplies we do have. And then we did partner with Heritage Mattress Company, and just this week they've started producing procedural masks for us. So we're continuously looking for opportunities to extend what we have and to obtain more supplies.
Well, I want to interject there, Dan, if I might. And I agree with everything Sheila said, but there is a nationwide, worldwide shortage of PPE, personal protective equipment. And the conservation strategies are very important, because while we do have some good supplies, we expect to see more patients. More patients are going to use up more supplies, and we are implementing a lot of conservation practices for PPE, and one of those is going to be the reuse of the so-called N95 masks. And up until this crisis, people would use them and throw them away. It's because there was a constant and ready supply that continued to be replenished. Well, the number one manufacturer and supplier is China, and those boats are not coming like they used to. And so we've got to take care of the current usage and what we expect to happen. And so conservation policies, appropriate reuse of those masks, we're implementing that right now. And so we will be reusing those masks until the guidelines say, okay, it's time to go to a new one. And Dr. Jones, Sheila, why don't you guys talk about what those guidelines for reuse are?
Well, I'll be glad to. The current guidelines are that you can use a mask until it is either gets wet or soiled, or it starts breaking down. And once that happens, you have to replace the mask. We also are issuing out 2 masks to people, and they can use them and swap them out on a daily basis. And that allows the mask to have time to kind of get rid of the viruses that are in there. So.
And we're covering our masks with face shields, and the face shields can be reused and cleaned and sanitized. So that's one of the ways that we're protecting and being able to use our N95 respirators longer.
And I think we should just point out again that we're working with the CDC. We're staying on top of the guidelines and their, the information that they provide about reuse and those types of things. It's not unique to Floyd. It's happening, as we said, all over the world. But I think.
Well, and there is a debate still as to the effectiveness of masks that you see people walking around in the community with. Homemade masks, as a matter of fact. I just saw an article today. It was posted on CNN, and it talked about how there is an ongoing discussion of that now as to whether or not a homemade mask that you wear to the grocery store is a good idea or not. And some people are saying, it may be a good idea. If for nothing else, it keeps you from touching your face too much. And maybe it provides some protection. So there's still a lot of discussion going on about the use of masks, homemade masks. So far here at Floyd, we're staying with the CDC guidelines. We're doing the reuse of the N95 masks, the surgical masks. We aren't using those in all locations, but we're trying to stay current with what all of the discussion is amongst the professionals.
And I think we can just say again that we're doing everything we can within the limitations that are facing all of us to keep our employees and patients safe. Dr. Jones, welcome as interim chief medical officer. That's quite the week to step into that role, but we are excited to have you with us. You spent most of your career as an ER physician, and there's a lot of conversation. You see it on social media or here or there about COVID-19 versus the flu. Can you educate us on what the differences are and how they compare?
Sure. both influenza and COVID-19 are respiratory illnesses, and they are spread person to person by droplets, and these droplets contain the virus. They are typically spread when that droplet gets exposed to your nose or mouth, so that's why we're encouraging people to not touch their face. Influenza has an incubation period of about 1 to 4 days. COVID-19 has an incubation period of up to 14 days, but the median incubation period seems to be in the 5 to 6 day range. When you think about influenza symptoms, they are generally very abrupt onset. They hit pretty hard over a period of a few hours, and COVID-19 symptoms are very gradual typically and can come on over a period of 1 to 2 days. When you think about preventing influenza, you think about vaccination. That's really all we have to prevent influenza. When you think about COVID-19 prevention, you think about washing your hands, don't touch your face, keeping that 6 foot of social distancing, and covering your mouth and nose when you sneeze or cough.
And I guess those are guidelines that are, they're good for general health any time of the year, but certainly
correct.
now. So is there any other advice beyond that you might offer folks now that, based on what we've learned since this has grown as it has?
Well, we can't preach enough how important it is for this social distancing. We've got to try to flatten out this curve that the CDC and all the epidemiologists are predicting. If we don't flatten out this curve, it's going to be a much harsher situation for our community.
We certainly want to encourage everyone to do everything they can. We support the local and state and national guidelines for social distancing, and we certainly encourage you to follow those. Kurt, this week we received some help. The National Guard came in and provided a medical team to support us here at Floyd and Polk and Cherokee Medical Center as well. Can you speak to some of what they're going to be doing and what that means to us?
We've got them spread out and serving in different areas. Sheila can help me with this. I think we got 2 APPs, physician's assistants. We got an RN, and I think the rest of them, that would be 7 others, are emergency medical technicians. So we have folks working in different areas to assist us, and we're going to need that. I mean, as Dr. Jones mentioned, the flattening the curve and the curve that's coming to us. We expect more patients. We're not sure when. We're trying to model that. Based upon the statistics that we see and statistics of how fast the disease grows, given the level of folks that have been exposed, what the infection rate might be, and how many of those are going to be okay and recover at home, how many are going to be critically ill and might need ventilators. We're trying to project that out. And right now, and all models are imperfect, but we're continuing trying to refine them. We think sometime mid to late April, maybe into May, we're going to start seeing the surge. We don't know how long it'll last, but the surge means a lot of patients, and perhaps more patients than we have beds currently, more patients than we have personnel, more patients than we have doctors. And so we're trying to plan for that so that we can get the resources in place as that demand ramps up. We'll have the ability to respond, and we're looking for all kinds of nooks and crannies to put patients if we have to. For example, one of the areas we're looking at is the recovery room of our now closed outpatient surgery center. Our outpatient surgery center is closed because we stopped doing elective surgeries. We stopped doing elective surgeries to preserve our personal protective equipment and then have facilities available to us when we're going to need them. So the recovery room over there, somebody got the idea, well, there's all the equipment, there's cots, there's monitoring, there's a nursing station. We can turn that into a nursing unit. And so we're looking at those kinds of things. I mentioned earlier we're going to have a temporary 20-bed unit out in our parking lot. That may not be the last one. And so these 10 folks from the National Guard, we're going to add to our labor pool. And we've got a team that's working on how do we match the numbers of personnel we have with the surge that's coming, and we may have to ask for more outside help.
I hear you speak, and I think more than any time ever we're realizing that necessity really is the mother of invention, isn't it? We're doing everything we can to find space and to find equipment and all of those things.
Well, and asking a mattress manufacturer to make masks for us.
Absolutely.
Right.
Before we wrap up, I would ask you, what would you say, just as maybe a word of encouragement or thanks or whatever's on your mind and heart about the job that our folks have done over the past month and are continuing to do as this moves forward. And Dr. Bennett, maybe we'll begin with you. Just we've got a lot of folks here at Floyd, and then we have a large medical community in Northwest Georgia anyway. What would you say to those folks about the job they're doing?
When you asked Kurt the first question about what does it look like a month later, the very first thing that came to my mind was how wonderful our staff have been to continuously, we as the month has went forward, we started with one patient, and we've had many more throughout our system, our outpatient facilities, our primary care network, our urgent cares, our inpatient side. We've not lacked a willingness, a motivation from our staff to step up and do the right thing for patients. I'm grateful for them because they've done an outstanding job, and our doctors have went above and beyond to be here around the clock to learn about this. And really, it's such a changing environment every day, every hour sometimes looks differently. We have used the CDC as our source of truth, but I can't say enough for how wonderful. And even the National Guard, you ask about those 10 men and women that came to Floyd yesterday. I mean, basically their message to us was, we'll do whatever. I might be trained as an EMT, but I'm happy to be a runner. Wherever you need us, that's what we'll do. And that basically is the attitude of our whole team.
It's wonderful. Anything to add?
No, I'd like to say I've only been the interim chief medical officer since Monday at 2 o'clock. But I was at Kirk and Sheila asked me to join a call team they have twice a day. And it started about 3 weeks ago or so. And to be honest with you, I was actually blown away with how they've managed this crisis. And this is even before Kirk asked me to be his interim chief medical officer. It's just amazing to me the team effort that they put together and moved this big, monstrous Floyd healthcare system 180 degrees when the CDC changed their guidelines twice in one day. So I'm honored to be a part of this team.
Well, and I guess I'll close that question. I think Dr. Jones is emblematic. I asked him, I said, we need a physician to, be here side by side. And he said, I'll help. And here he is. And it's just emblematic of physicians and nurses and everybody else that are willing to step into harm's way to do what it takes to take care of our community. It really is humbling to see that. And we get the privilege to work with these kinds of heroes on a regular basis, and they really are heroes. The President Trump has said these are going to be a difficult 2 weeks, and we shouldn't sugarcoat it. It is going to be difficult. People will get sick. People will die. We're doing our best here, and there are really great people here at this hospital, like there are at hospitals throughout the nation. And I think folks are seeing how important hospitals are to the fabric of society, and they really are. And people do amazing work in hospitals.
If I could add one more thing before we close, I want to thank the community as well, because they have really come together. They've provided food and T-shirts and motivation and prayer, everything for our hospital. So thank you to the community members who may be watching. So we could not have made it these last few weeks without them. So thank you to them too.
Agreed.
No question about it. Well, thank the three of you for joining us this afternoon. We appreciate this very much. We wanted to get in front of the public and wanted them to hear from you about the great work that's being done here at Floyd, not just now, but year round, but especially now to see folks step forward. And we really appreciate you taking the time.
Thank you, Dan.
Thank you very much.
Thank you.
We'll be joining you for the next few Wednesdays anyway. This is we don't really have an end date for this, so we're going to do everything we can to be transparent with you and be open about what's happening here at Floyd and how we continue to manage through this crisis. And we'll have different folks join us from one week to the next to provide their insight about where we are. And so we encourage you to continue to check out Floyd's social media and follow our schedule for that. And also be sure to go to floyd.org. We have a continually updating site that's providing great information about COVID-19. If the CDC changes a guideline this morning, it will be on floyd.org just as quickly as we can get it up. So it's a great resource for you, so we encourage you to do that as well. Thanks so much for joining us today on this special Facebook Live. Thank you again, as Dr. Bennett said, to everyone in the community that's offering support and encouragement. We appreciate it and we feel it, and we look forward to talking to you again very soon. Thanks for being here.